thank you for tuning in today and welcome to CTO Talk. I am your host, Matt Ferrari. On this 30-minute program, we're going to discuss the issues, challenges, and opportunities that are impacting healthcare technology. You can follow the show at Twitter at #CTO Talk and follow me at MP Ferrari. Today, we're going to do something a bit different. I'm really excited to have with me at HIMSS, Jamie Philyaw, who is the Vice President of Care Management at Community Care of North Carolina, and Sue Powers, the SVP of Sales at VirtualHealth. Really excited to talk today about case and care management. And truly, this is a great time to talk about it here at HIMSS, a hot topic. So welcome to the show.
Thank you for having us. Thank you.
Really excited to be talking today. So let's get started. A little bit about your backgrounds. Sue, why don't you tell us a little bit about yourself?
Sure. So I've been in the business of healthcare on the vendor side, so selling solutions since the mid-90s. So very much focused on finding solutions and being part of companies that can really change the dynamics of the healthcare organization. So I've worked for companies such as, obviously, VirtualHealth, but Array Health, Netscape back in the day,
wow.
Tandem Computers back in the day. So a lot of variety of companies that have really, I think, brought me to where I am today, which is really trying to find the best solutions that make sense for a client and fit the goals and objectives they're trying to make.
That's great. A bit of a sidebar, I was at a Google Cloud Summit about summertime, and I was asked what my first web browser was, and mine were old. Mine were before Netscape.
Yep.
But most of the room's first internet browser was Netscape in the room.
Yeah,
almost every single person.
Yeah.
So very interesting.
I remember that.
Well, thank you very much.
Thank you.
Okay, and Jamie.
Yeah, so hi. Thank you for having me, by the way. I'm always appreciative of telling our story at Community Care. I am a social worker by profession, have been in healthcare since I received my master's of social work degree and have worked in various healthcare systems. Worked in acute care and rehabilitation, and then around 11 years ago came to Community Care of North Carolina and actually worked with one of our local networks, which I'll talk a little bit more about throughout the podcast, and was a care manager.
Okay.
And then from there, worked in behavioral health integration and then led that network, and then in the past 12 months came over to our headquarters, our central office, to lead our statewide care management program.
Very good. Yeah, I'm really interested in learning more about this. My background aside, what's interesting about the organization that I work for is we started in rural access facilities and then into community facilities and community care facilities, and so I get to hear these stories a lot. So I'm really excited to learn more today about kind of your view on the topics. Thinking about, CCNC, can you kind of describe for me the mission and the scope of services?
Sure. So we have been a formal organization since really about 20 years ago. We began in several counties in North Carolina and have since evolved to cover all 100 counties. So we're a community-based not-for-profit organization that really serves the primary care medical home. So we have around 1,000 medical homes that are connected to CCNC and over 6,000 clinicians. We have about 1.6 million covered lives that we provide coordination of care. And so we do care management to at-risk populations. So really the mission is working with underserved populations, and then those patients or members with multiple chronic conditions, and then providing that extended support to our primary care practices. So we really try to extend the medical neighborhood and provide coordination of care that makes for a more informed medical home. Excellent.
As you think about, bit off the beaten trail here, but as you think about your mission, how do you ultimately recruit talent? I think about a lot of the conversations I have every day, and it's all around getting folks in healthcare to think about how can they not just have a job, but transform their business. Obviously, you're in a very sensitive and empathetic, part of the industry. So how do you guys, from like a core values perspective, how do you think about that?
Yeah, I think that's an interesting point, because what we have found is those individuals that stay with our organization the longest are those that are mission driven and aligned with our organization. We do have a multidisciplinary team that provides this care coordination. So we have nurses and social workers that are really driven to working with the underserved. We have pharmacists and patient coordinators, and then we're ultimately provider led. And I'm not not sure if you are aware, but North Carolina, I believe, has the largest primary care medical home system that provides care to Medicaid population.
Okay.
So our biggest book of business is the state of North Carolina, who currently administers the Medicaid program. We are moving towards reform. So I think the fact that we are providing that extra support and that we have this robust system is how we keep providers interested in providing care to the underserved population. And I think the support that our boots on the ground staff are able to be embedded in the communities. A lot of our care managers are from the communities that they serve. So we are embedded throughout the 100 counties of North Carolina.
Wow.
Yeah.
Wow, that's very helpful. Yeah, I have the opportunity to speak with a lot of folks, and what I've learned is that talent is so difficult in healthcare because, look, it's not necessarily the most exciting industry for a lot of young up-and-comers, right? Unless you have empathy for how to serve, right, and how to help populations. So that's really
and it's
humbling.
challenging.
Yes, absolutely.
And you do have to focus on the small successes.
Yeah.
We engage patients that have multiple social barriers. And so trying to overcome those is very difficult. So we really do try to meet the patients where they are. Try to determine what their goals are and make it a more collaborative approach. I think that's where you get more buy-in from the patients, and then and being able to appreciate those small steps of successes.
Absolutely. So, Sue, how about yourself? As you think about virtual health, can you talk to me about kind of the mission and the scope of services? I'd love to think about how the synergies of your two organizations work.
Sure. Yeah. So, our founder and CEO, Adam Sabloff, his mission really revolved around some personal stories for him, where he had a relative who had a terminal disease, and he became the caregiver. And through that experience of bringing in all this disparate providers and trying to coordinate everything, he realized how difficult and somewhat broken the healthcare system is. And so what he made his mission was to develop a platform that would provide collaboration and coordination of care, not just in one siloed organization, but across the whole healthcare continuum, from the patient to the caregiver to the provider to the organization who's providing that care, et cetera. So really everybody collaborating and coordinating around care, and that's the mission. And so it jives really well with what CCNC is doing as well.
Yeah, no, that's very helpful. Offline, actually, you and I should have conversations. I have these organizational conversations quite often with similar facilities that have the problem that you just described, that run into a problem where when care is needed, systems are so disparate, getting data is so difficult, and really there's real struggles around kind of managing that high risk, vulnerable population. Right. So I'd love to hear from either of you. What challenges do you see kind of associated with managing that kind of population risk?
I think I'll start. And I've already kind of alluded to this. Is really it's getting a lot of buzz now, but you hear a lot about social determinants of health. And as a social worker, I appreciate the recognition it's now getting, because I feel like we have been addressing it for so many years since the inception of the profession. And so I think that plans and providers, and as we move towards a more value-based approach, that there's a lot more attention given to social barriers. And I think that as we encounter patients and we look at the impact it has to their healthcare outcomes or their access to care, we first have to start by identifying those barriers and addressing them. So I think, what makes CCNC unique is that our local presence, we like to think of ourselves as a neutral convener. And so we have these rich relationships throughout our local communities. So with Meals on Wheels, with our local churches and faith communities to help provide these services to our patients who are having issues with housing, food access. So we're thinking about starting to address issues around their diabetes or their asthma. If they don't have appropriate housing, or if they don't have access to an appropriate diet, then it's going to be very difficult to see any progress as it relates to their outcomes and health.
Wow. Out of curiosity, how do you best measure those outcomes, or how do you best measure success as you think about the business?
That's a great question. So I think, we start with the small successes, right? We have a lot of robust data. So we can talk a little bit more about that as well.
Sure.
But a lot of it is around access to care. We look at, admissions and readmissions. And one of the things that we have done that I feel like is a little different across the country is we look at risk and we look at predictive analytics. We also have an impactability score. So because we've been in the business of care management and population health for over 20 years, we're able to look at those patients and clinical risk profiles that show patients are more amenable to care management interventions. So it allows us to deploy our resources more appropriately, and then also allows us to measure more return on investment.
That's very helpful. Sue, did you have anything to add there?
I did. So as Jamie was talking about the social determinants, that's a key feature, a key focus for us. So whole person care.
Yes.
Okay.
So you worry about the clinical side, of course, but you have to also worry about the social determinants and what that risk is for a specific patient on both fronts. And so that's a key area that we focus on and complements the resources that CCNC has.
Yeah.
But also making sure that the care team is really productive and efficient, particularly with CCNC because of their local networks. They're not together, even as care managers and care coordinators. So the ability to have a platform that virtually brings them together and allows them to have effective and efficient interactions, as well as automating a lot of the workflow that allows them to be more productive, allows them then to spend time with their members and their patients so that they can improve those outcomes rather than looking for information in this system or that system.
Yes.
It's all in one.
Yeah, that's very helpful. The reason I asked about measurement and KPIs, and it sounds kind of like you guys already caught on to it, is this is only my fifth HIMSS. And I've been lucky enough. Okay.
Yeah.
Okay. I've been lucky enough to have run a couple of companies before, but as I got into healthcare exclusive, what I learned very quickly is buzzwords without measurements are pretty dangerous things. And you mentioned data, so let's talk about it. The reason I asked about KPIs or key performance indicators is a lot of times when I hear about population health, you hear organizations really excited about utilizing population health to drive better outcomes, but ultimately have no way to measure success, have no way to understand how it actually affected either their bottom line or the patients that they're taking care of. So I'd love to hear, what role does data have in effectively managing pop health, and what challenges have you guys seen?
So, the thing that I think really matters is taking that data and the analytics that are powered by that data that tell a story. But not just looking at that and saying, oh, isn't that interesting? Actually looking at that and then taking action based on what you see. Because that's where the power is of those analytics, is when you can actually do something proactively that's going to improve the care. So VirtualHealth is partnered with SAS around their analytics. It's actually a recent partnership, but I'm really excited about it because it's going to allow us to really dive deep into advanced analytics and predictive analytics, and then based on those things, drive through the care management platform, drive action for the care managers and the care coordinators to do something based on the analytics. And that's how you're going to determine, did we really succeed in an ROI and in a measurement?
Yeah. Well, congratulations. I didn't know about the SAS partnership. Obviously, an incredible ecosystem and so much data. So that's humbling.
We're very excited.
Yes,
and we're excited. It's another North Carolina-based organization.
Yes, absolutely.
So thank you. No, I think Sue makes some great points. At CCNC, we rely on data to drive our care management and our practice support, and we rely a lot on claims and a lot on we receive daily feeds from around 100 hospitals across the state of North Carolina where we get admission, discharge, and transfer feeds. But and you said it well in terms of getting a proactive look, and so being able to automate and identify patient trends in more of a real time scenario allows us to act in a more timely intervention. And so being able to provide those timely interventions to prevent readmissions or prevent an admission. And so, and we're continuing to evolve with that. We haven't always had real-time data or daily data, as my analysts like to tell me. It's not really real-time. So I think that's where we have continued to improve. And I think our partnership with VirtualHealth is going to continue to enhance that. In terms of challenges, I would say that, as we are documented in our care management platform, as we're accessing the hospital EHRs and our physician EHRs and our community partners, we still have a challenge around interoperability. And, we want our physicians to log into our system. We want to have that common care plan with all the providers that are involved in that patient's care. And so that was one of the reasons why we selected VirtualHealth, is that we knew as our partnership continues to grow and we understand their capabilities, that we're going to realize that. I think that also for the state of North Carolina, as our state HIE comes more to fruition and comes online, that hopefully that will improve that as well. So.
Interesting. So you just led me to where I was hoping to go. I'm a visual person. Unfortunately, this is a podcast, so we don't have a whiteboard. How has as you think about Pop Health and even interoperability, how has the partnership with VirtualHealth kind of improved your outlook? And, I'd love to learn more about the partnership itself and how you guys came to be.
Sure. So I can start. And then, so you're catching us at a good time, because we're just kind of getting started, actually.
Oh, so great.
So as I've talked about, Community Care of North Carolina's approach to care management, we have a legacy documentation system that we've used and we built in-house. And so as we continue to move forward and we begin to take on new business and we move into Medicaid reform in North Carolina, which will soon be privatized, we realized that we couldn't continue to conduct business in an efficient manner with our current system. So we had to make the decision, do we continue to build in-house, or do we go out and really advance our technology and form a partnership with a vendor that meets the needs of our program? And so we went through a rigorous process that began in November 2016 and ended in February 2017, and ultimately landed with VirtualHealth. And I really feel like this is the right partner for us. It's the right product for us. When you look at the mission of what we do and the whole person care that Sue spoke of, and that multidisciplinary care team approach, that's what VirtualHealth offered. They also offered a partnership that was really unparalleled as we looked through other vendors. So we had a top 7, then we went to a top 3, and then ultimately landed here. So we are actually in our 3rd month of implementation.
Wow.
So we really feel like that it's going to lend itself to a more intuitive user experience. It's going to allow for us to have greater efficiencies. And when I say greater efficiency, my hope it really improves the quality of care management and practice support that we're providing as it relates to population health. And so we're excited. We're going live in October of 2018. We're designing a lot of the functionality right now. So it's challenging, but in the end, I think it's going to be the product that we need to move CCNC forward, not only within the state of North Carolina, but my hope is that we expand outside of the state of North Carolina with multiple customers and ready for the new healthcare landscape.
Right. And, the partnership is really strong because they are doing some really unique things in North Carolina, and that's something that we're very interested in being part of. And because of the way this platform is designed, it's very customizable and configurable. So we're able to take the uniquenesses of CCNC and allow the platform to promote that and make sure that we are fulfilling the goals that they need. So that's a really great part of what we do. And so I think that's key to it, as well as just the idea that we're going to come together. We see ourselves as true partners. We don't see, we don't have a vendor-customer relationship. It's a partner relationship. And so with that, we're going to, implementations are difficult. So there's always going to be stumbles, but we're going to work through all of those at the highest level. Everyone is committed to making that happen. So we went through the rigorous process, but we're so excited that they chose us and we get to go forward with them. And because this is going to be something that I think they will spread to different states, and it's going to be a model for other folks to look at and say, that's what we need to do. Yeah.
So 2 things there. And Sue, you just said it. The interesting thing that I've learned about implementations, whether it is even an EHR migration or implementation, is this is hard. Healthcare is hard.
It is.
And look, this is called CTO talk, and there's some times where I get to talk about cool tech and nerd out. But the truth is, this is a very, very hard business. And you mentioned bill versus buy, which is something that I deal with every single day of my life. I come from a world where I ran software development and wrote code, but the truth is you think about CCNC, you're probably thinking about, is this the best and brightest use of our people and our talent?
Exactly.
Right? Does this help us advance things like behavioral or health risks for early intervention, or am I bogged down in maintaining a legacy platform? So I would assume as you went from 7 to 5 to 3, a lot of the considerations were, could virtual health help CCNC focus on what we're best at? Is that an accurate depiction?
Yeah, does it lend itself to efficiency? Does it promote quality? Is it supported by, clinical guidelines? Also, is there more interoperability in terms of our interactions with our providers, and then also our members? They offer a member portal and a caregiver portal, which is new to us. We actually do not have that functionality. So I think what's going to be very helpful for our care managers is to be able to securely message and have interactions with our patients or members through this portal. And the same with our providers. We have a provider portal now, but it's not driven towards any type of communication or getting their input towards the care plan. That's done in more of a real-time basis. And so having them be able to log in and do a referral, but also add really pertinent information to that care plan is going to be key. And I love the idea of the caregiver portal. That's probably not something we'll do on day one of Go Live, but it's certainly something that we're going to roll out. We have a robust foster care program that I feel like will really benefit from that. So I'm looking forward to that. So again, having that expanded functionality that right now, we're going live with care management, but Virtual Health offers 5 portals. And so as we think about expanding our business, we're really purchasing software that's going to move us forward as we evolve.
Excellent. The other thing that I thought of as I was thinking through both of your answers was, not only is it difficult, but change is hard. Almost my entire family is in healthcare. I'm a black sheep, and as they think about things like digital transformation and a migration to a new app or a new patient portal, it's hard to get clinicians excited about change. How do you guys approach that? How do you approach that in CCNC, and how do you approach that at Virtual Health?
So the way that we do it at Virtual Health, it's really straightforward. So I'll talk to somebody about what we're doing, right? And they'll kind of get it. But then I say, please let me show you the platform. And when I show them the platform, all the bells and understanding goes off, because the platform is extremely easy to use and very intuitive. So I love to go and present to care managers and care coordinators. CCNC is a great example, where the room is full of folks who've been doing this all their lives. They're not necessarily tech savvy, right? And they're concerned. And then we let them play with the platform. And it was like, well, this is not hard at all. This is very intuitive. This is easy for us. In fact, a short story, one of their trainers who was in charge of it, she was worried about, having to teach a new platform. And she had looked at one and she was like, oh my God, this is impossible. How am I going to train my people? And then she looked at ours and she kind of chuckled and she said, I'm not sure I even need to train them. Wow. It's so easy. So that's the story, right? That they told us. So that's where I go, is please let me show it to you.
Yes.
Okay. And, as a follow-up, you just described something that actually our audience runs into a lot, Sue. On the software side or the technology side, how do you guys approach making it easy? Like, it sounds like you focus on the user experience and the customer experience often. Is that how do you go about that?
So when the platform was being built, it was, and we use the word purpose built for integrated value-based care. We launched it the platform in 2014, so it's pretty new and it was cloud-based. So if you think about what I just said, it was purpose-built for this. The idea was, we've got a whole bunch of different types of people, different audiences who are going to be using this platform. We have to make it easy for the caregivers, for the members, for the providers. And so our engineers, our developers made it, very much a focus of theirs to make it pretty simple. And then, of course, after we launched, we got clients. We love client feedback, and we iterate very quickly with this system. So people said, hey, you know what? This is not easy or intuitive. We'll fix it. So that's kind of what we've done.
Absolutely. Very good.
And I'll just add from the clinician perspective, you talked about how do we get buy-in from the end user, and that is a challenge. And we have 1,700 users and around 800 care managers across the state. And so, and you're right, we have to show them how is it going to impact their day-to-day workflow? How's it going to make me better at what I do and the care that I deliver? And so, and I think that Sue's exactly right. As we made sure that we had end users as a part of the evaluation progress, and so we had that buy-in. buy-in. So I think that that's helpful as well. But as clinicians, even the implementation's been very difficult, and the design. And you're right, it's not what we do. But how I keep folks motivated is that just think of the piece that you're providing in terms of building our future.
Yeah. So. Well, for what it's worth, kudos to yourself. Most implementations that I see, and so you may agree, across the industry are very focused on rushing to market to meet a deadline, whether it is gain meaningful use or pass an audit or get out of a data center. So to sit back and do what you described as almost like a vetting or an RFP experience, and then think through a year of architecture and implementation, that's rare. In my experience, that is rare. So kudos to you guys. I have the opportunity to see a lot of pop health and EMR migrations or big data migrations, and the truth is, what does Gartner say? 70% of these projects fail, right? And I honestly attribute to a lack of thinking. And what is the outcome? Yesterday, I sat in a cloud forum, and the CIO of Beth Israel got up and spoke about how he is moving away from technology and infrastructure as his thought. He's now moving to outcomes as a service. Ultimately, at the end of the day, what is this tool or what is the system going to give me in terms of an outcome for my patients? So just thinking about that. A final question, because I know we're running short on time. What should CCNC and other community health organizations be doing and thinking to continue to elevate population health and kind of other strategies that you're seeing as it relates to that industry?
I think first of all, I would say strengthening the primary care medical home system. Okay. So as we're moving forward to a value-based approach and value-based pricing, I do worry about our primary care practices, especially those in our remote areas and access to care. And so continuing to support our providers and our practices. I'm sure I am preaching to the choir when I say that continuing to address and being innovative in addressing social determinants of health and the impact it has on our patient populations. And then again, I think strengthening and continuing to improve interoperability. So, our patients have multiple providers. There's, expanding the medical neighborhood, but making sure that we're working from a common care plan.
Very helpful. And Sue, any advice for the audience or other community care facilities out there?
Well, I think Jamie hit on some definitely key ones. The other one I would add is breaking down those walls between the different constituents that make up that care team. So don't let people stay in their silos, but kind of really encourage and maybe somehow force that collaboration and coordination so that you optimize the care that you're giving and hopefully then improve those outcomes and lower the costs, because as we all know, healthcare costs are out of control and we have to find a way to bring those down. And I truly believe that this kind of a partnership can make that happen.
Yeah, no, that's a hot topic. I've now been, as I mentioned, to 5 HIMSS, and interoperability, pop health, but ultimately reducing cost is just such a hot topic. And well, thank you very much. For those of you who are tuning in once again, today we had Sue Powers, the SVP of Sales with VirtualHealth, and Jamie Philyaw, the Vice President of Care Management at Community Care of North Carolina. Appreciate you both for joining us today. For listeners, if you are interested, feel free to reach out on Twitter at MP Ferrari or hit me up on CTO Talk. This will be on healthcarenowradio.com, and you can learn more at cleardata.com. I'm Matt Ferrari. Until next week, let's talk soon.